How common is cat giardia? If you are a cat owner, you might be wondering about the prevalence of cat giardia. This microscopic parasite can lead to gastrointestinal issues in our feline friends. So, how common is it really? Studies indicate that about 4% to 10% of cats test positive for giardia. However, this number can vary based on several factors. For instance, the prevalence can be higher in symptomatic cats. If your cat shows signs of diarrhea or vomiting, the rates can jump to around 10% or even higher. One large study in the United States found that about 10.3% of symptomatic cats tested positive for this parasite. In contrast, the overall prevalence in the general cat population, including those that are healthy, is lower, around 4%. This data comes from fecal testing conducted at veterinary reference laboratories. Age plays a significant role in infection rates. Younger cats, especially those under 6 months, are more likely to be infected. Their immature immune systems and behaviors, such as increased grooming and exposure to contaminated environments, make them more vulnerable. Older cats tend to have lower rates of infection, likely due to immunity developed over time. The environment also matters. Cats living in shelters, catteries, or group housing often have higher rates of giardia compared to those in single-owner homes. Geographic differences exist, but they are generally less pronounced. From a veterinary standpoint, it is essential to consider giardia in cats showing gastrointestinal signs, particularly in young cats or those in multi-cat settings. Diagnosing giardia typically involves fecal antigen testing or a microscopic examination of feces. If your cat is diagnosed with giardia, treatment usually involves specific antiparasitic medications. Additionally, good hygiene practices and minimizing exposure to contaminated water or environments are vital for control. In summary, giardia is a common intestinal parasite in cats, with prevalence ranging from about 4% in the general population to over 10% in symptomatic or high-risk groups, particularly young cats. Awareness and testing are key for effective diagnosis and management. If you have concerns about your cat's health, don't hesitate to reach out to your veterinarian for guidance.